Welcome to AgeLess. I'm Dr. Jonquille Chantrey, and this is a podcast about uncovering the truth about healthy aging, self-development, and medical aesthetics. As a surgeon, beauty scientist, research, and yoga instructor, I've examined aging through the lenses of data, culture, physiology, and psychology. I don't see aging as decline, but as evolution. And in my philosophy, aesthetics, longevity, and mindset are inseparable. When aligned, how we look speaks to our vitality, our purpose, and our authenticity, not to time. That's what AgeLess is about, a deliberate rebellion against uncompromising and reductive beauty ideals, false information, and flat narratives of aging. Today, Francesca steps into the role of guest host, asking the probing questions that illuminate the philosophy of AgeLess, reveal stories from my practice, and surface the research that continues to guide our journey. As Tatler magazine's health and beauty editor-at-large and founder of the Beauty Triangle, she shapes conversations around aging and aesthetics with rigor, empathy, and insight. If you believe aging deserves a richer, more authentic narrative, we'd love your support. Please subscribe, review, or simply share this conversation with someone you care about. Francesca, welcome, and thank you for joining me on AgeLess.
This is amazing. We have so many conversations offline, you and I, about all of these concepts, everything that you do in the aesthetics industry, and it's exciting to be having this moment here together. The beauty mastery. Mm-hmm. This has been a huge body of work for you. Many years, many ideologies, many constructs that you've woven into it. What sort of got you to the point where you wanted to create this piece of work?
So the intention behind it was to elevate medical education originally, actually. Mm-hmm. So it was to help to improve our understanding of patients, not just their motivations, but their anatomy and what's actually happening from a diagnostic perspective.
Okay.
But also to elevate the conversation around beauty, around aesthetics.
I love that.
And also to help to elevate the intelligence around this and the consciousness. So
exactly.
there was a bigger underlying reason for it.
I think it's bringing some intellect and some... I don't know, a little bit more depth to the conversation as well, taking it beyond the superficiality, which I think aesthetics often gets painted with, and allowing us to look at it through a slightly deeper sort of lens. Mm-hmm. Am I right in thinking there are 5 spheres to the beauty mastery?
Yeah. There are 5 spheres.
Can you go through those? What are they?
Yeah, so the first one is biology, and it encompasses all things like anatomy, psychology, but I also bring in neurobiology, anthropology, because that's really important to actually respect.
Understanding our sort of origins and our ethnicity and how that sort of comes out and is expressed aesthetically.
Definitely, but also in terms of our mindset and our emotions. So whilst we might be highly evolved beings that believe that we're fully in control of our choices, there are still things that, sit within our DNA that epigenetics haven't completely taken over and are still driving us as to the choices that we're making consciously and subconsciously. So this is a big part of it. Anyway, so the biology part is really important. And it's really great to apply that to every type of patient that I'm seeing through the door, every individual. I find it really, really useful.
I know you've said that you don't really define the patient who sits in front of you by their age, by that number, but do you find a little bit of awareness around longevity, around health span creeps into the biological sphere when you're assessing the patient?
Most definitely. And you can look at that on a cellular level. Mm-hmm. So thinking about what are the kind of lifestyle factors, environment, diet, obviously nutrition, sun exposure, drugs, chronic illness. What are the things that might be impacting their cellular health? I just did a really big lecture on it actually this year that was really great to do. But also just on a physical level of what you can see. So that really, really helps to think about that in a more structured way.
Yes, exactly. Well, it's understanding sort of what lies beneath the surface, but also, what we're presenting with externally. I suppose both of those things are very important for you to understand.
Definitely. And, I think with aesthetics, often I hear, oh, I like to do it this way, or I want to do it this way, or, oh, my patients have this kind of signature look. And I think there's an element to that, but I also believe that this should be rooted in science. It's where it starts, it's the science. And so what comes from that is obviously understanding the human that is sat in front of us.
Yes.
And that is a very complex biological system that we need to be considering all of those different elements of. And then I go further. So
the patient's mindset is of huge importance within this sphere as well.
Absolutely. It's the reason why they walk through the door in the first place. It's behind their actions and their choices. So it can't be separated out. It's a critical part of it. And so much of my work, in terms of research and the studies has been around and understanding those different types of patient motivations. And I felt so strongly about it that, again, I do believe I was the first clinic that I knew of, certainly in Europe, amongst my peers, that brought in a psychologist into the clinic. Now, it's a fairly normal thing that you might frequently hear, but then nobody was bringing in.
When was this that you brought a psychologist in?
I think that was in 2010. It was right.
Gosh, that's a long time ago.
It's a long time ago.
You frequently hear cosmetic surgeons sort of stressing the importance of, potentially referring to a psychologist if they suspect that a patient isn't in the right frame of mind to pursue a procedure or whatnot. But that was a long time ago to be doing that. It's very sort of visionary.
It was. It was so important, and it was an option as well for patients if they wanted to speak to anybody about those sorts of things. And again, in the studio, we create another option where, again, it creates a safe space. We speak in circle, do meditation events.
Yeah, you bring in some other beautiful practitioners and practices, don't you?
Yeah, so I do still consider that under the biology sphere.
Yeah.
Another big driving factor of me is my patients and wider society having better relationships with their own self-image.
Yes, I think that's hugely important right now.
And I see these incredible transformations with people one-to-one and in the community that we have, where it might start a certain way. They can be really hard on themselves. Quite frequently, patients can be perfectionists, etc., really tough on themselves. But because of the neurobiology, because of the ability for the brain to have that plasticity, their self-image can develop.
Yes.
And they actually start to use much more positive language about themselves. It's very important. It's very, very important within my own environment. I find it a very, very crucial thing. I'm very aware of negative conversation,
negative energy,
negative self-talk
that
I'll hear. And I would like to say that after being as part of our community, a lot of the people who are in it, they might not necessarily be patients, but I do see that lighten up and that lift. So that's really great. And again, leading on from the science, the second sphere is maths. So, for instance, when it comes to beauty, there are parameters that we measure. There's geometry to it.
Absolutely. I mean, we often hear about the face being split into the 3/3, the 5/5 going sort of across the face horizontally, the golden ratios, all of this thing. It's important for you, I suspect, to have an awareness of that, but also not fully subscribe to it and try to get everybody into that cookie cutter perfect beauty ideology.
Exactly. Really important to understand it, know it. It can be a really useful tool to apply to a different face, different ethnicities, a different gender. It can be a very important basic platform to understand beauty. So again, it's a really big part of the teaching work that I do. And then the next aspect is technique. So that then plays into it. That's the next sphere. And that's, again, to do with absolute excellence. So clinical excellence, there's ethics that come behind that as well. But what can we do that is making sure that we're choosing the best tools?
Yes.
That we're applying it in the best possible way. And this is constantly evolving and needing updating. That's why I still love to work in clinical product development, do a lot of consulting for that. So make sure that we've got the best efficacy behind the products.
So I suspect it's using the right product, but also the right placement. We always talk about it has to be the right product in the right practitioner's hands as well. So it also comes down to your awareness of where you're placing that within the facial anatomy.
Most definitely. And then the fourth sphere is art. So you can see that there's a few little artistic points around love Da Vinci,
little sculptures,
language of faces.
Yes.
Picasso, Michelangelo's tireless work in trying to perfect the sculptures that he did. I mean, it's just incredible. So
a lot of doctors and surgeons often refer back to sculptors as a sort of, I suppose, an inspiration somewhat. And so much of what you are doing as an injector is sculpting the face. I mean, you may not have your scalpel like a surgeon would, but you still have all of those means and those products and those devices and those to sort of sculpt and create that three-dimensional, piece of work.
It's really important to respect those different dimensions.
Yeah.
And I think a lot of doctors within the space, they are very scientific and very left-brained in terms of the logic of things as well. And they'll get it from A to B pretty quickly. But then we have to incorporate that right hemisphere of creativity.
Absolutely.
And understand our own beliefs and perspectives on that, but also look for blind spots. And I think it's those blind spots that can sometimes create so many poor outcomes as well, aesthetically.
I think it has to be the perfect blend of science and art, doesn't it?
It does.
And it's funny because psychology is such a key thing for you, and psychology in the same way is also defined as a science as well as an art. And I think it's just that appreciation of those two different lenses through which we're viewing it.
Yes. And then the final one is culture. So my final sphere that I always consider whenever I'm speaking, writing, consulting is culture. And what do I mean by that? There could be political elements to it, often, certainly media and now social media. The impact of these influences on groupthink, on behaviours within different societies, and ultimately the consumers of beauty and aesthetics and now longevity is really, really crucial. And that's where a lot of my trend work comes in, where I like to look at a lot of observational studies or, as you know, consult for quite big trend forecasting companies to predict what's going to be new next in the next 10 years. There have been some products where we've been working 15 years in advance as to where do we think the industry might be going and what patient needs will be looking like. But quite frequently that's coming from understanding the cultural aspects.
The culture is so interesting. Do you find the different generations of patient that you're seeing, they're obviously exposed to culture in different ways, aren't they? And we engage with different platforms, different forms of culture as well. Do you see any differences between sort of maybe your 20 to 30-year-olds coming in versus your 80 to 90-year-olds in terms of the culture that is shaping them and their aspirations?
Yes. Where we did see a real changing point was when the millennials really found their voices, and that's had such a big impact on the beauty and aesthetic industry because they were one of the first generations to really influence up and influence down. So there were people who, were in their 60s and older 60s, but they were being influenced by their millennial children, grandchildren, whatever.
Absolutely.
And
they say that younger generation are so much more open-minded to trying things, to experimenting, to altering. I think they're far less scared than their parents' generation, their grandparents' generation, for sure.
Yes, we definitely see that. And again, it was concerning as well that we were seeing such huge change and transformations, but was that actually what they were wanting? Were they going into it with that expectation, with that motivation? And it got a little bit out of hand. I think there's still a lot of work to do with that. But also,
Agreed.
Haven't we seen just the incredible limitless nature of beauty and aesthetics? And there's a playful nature to it as well in terms
Absolutely.
of makeup and that ephemeral expression that we see. So there's a lot of exciting inspirational aspects to that as well.
Tell me a little bit more about the trend forecasting that you do, because you work with some big global pharmaceutical companies, beauty companies. You created the Future of Aesthetics Trends report in collaboration with Allergan.
Mm.
Was the beauty mastery almost what fed into the trends report, or would you say your trends forecasting is what inspired the beauty mastery? How did those two feed into one another?
So I actually started my trend forecasting work quite a long time before. So the beauty mastery came much later when I was trying to rationalize and get this into some sort of formula.
Yeah.
So that came later. The trend forecasting, I always loved doing it. I always thought, wow, such a privilege to be invited in to think tank.
Yes, exactly.
So, to sit with, this huge broad table and have brilliant minds in a room and just be able to listen to them, learn, and then give my opinions as well, but also look at the data as to where we really thought things were going to be shaped. So again, that's incredible balance of the artistic, cultural awareness and creativity, but also looking at the data and watching and listening. There was a lot of listening that we do.
Do you often see when sort of historically you've done the trend forecasting and you've sort of come up with your predictions all collectively, do you often see those, in a number of months or years actually coming into fruition?
Yes. And as you well know, how quickly trends can come within aesthetics and they can take huge, huge power.
Absolutely.
I don't know if you remember, was it 2019? And I'd been working on an injectable and a technique to inject chins and jawlines.
Okay.
So
I remember this.
I'd been working on this, I think it was 5 years before. And it was myself and this brilliant scientist who flew over to my clinic in Manchester from LA. And we sat there and we were like, okay, historically people were having surgical chin implants. And how can we move forward so that people aren't needing full surgery? How can we reshape the chin? How do we make sure that it's in balance with the nose, with the forehead, it's gender respectful, etc.? And what does that going to mean to the jawline? Because as soon as you start to treat the chin in profile, then of course the jawline is impacted. So we spend a lot of time looking at data, looking at ways to measure. Again, the maths came into it.
Yeah.
And then we came up with several different techniques and we knew that it was coming. So this was coming in parallel with there was going to be a need to manage the lower face. Because before that, people were injecting foreheads and they were injecting cheeks.
And they were ignoring everything from yes, exactly.
The patients were coming and complaining about the lower third of the face. So we knew it was coming and we were right, how can we really responsibly and ethically do this right and in a way that has really high efficacy? So there was a lot of work that went into that. And then I remember I did the first live demonstration of this, and this was in Monaco at the World Anti-Aging Medical World Congress, 2019. I had a very short period to do it. And I remember
no pressure.
it was high pressure. And I brought on two sisters, one who'd had facial trauma and one who was getting married and so wouldn't have been able to have a chin implant or go down liposuction to the chin route. And that was a really exciting moment. Those transformations actually earned me an award for best non-surgical results at that time.
Congratulations. I mean, it must be amazing to see how something like that sort of level of trend forecasting can trickle down and almost become a more democratic concept that then becomes mainstream and worldwide. I mean, that must be the ultimate sort of accolade for you, seeing your ideas sort of come out in that direction.
It's crazy. It's not even something that I necessarily talk about. And, there'll be patients that will come through the door or people that know me and they won't know that they'll say, oh, do you do jawline? And I'm like, oh, okay.
Just a bit.
So it's not necessarily something that I've really talked about a lot. But it's great because the reason, thank you. And the reason why as well is because so many people were thinking that they needed surgery. They didn't necessarily need such extreme surgery to achieve the results. So, there's that very, very positive side of it. And then again, as an observer of what happens within the culture and within the industries, it was how quick this was adopted.
Yes.
before any time at all, it just absolutely blew up, and so many people were having chins and jawlines injected. So yeah, it was pretty crazy.
There will always be a new trend. There will always be a new ideology, a new sort of construct, sphere of beauty that we're all adopting and jumping on the bandwagon to. But I think it's finding these practitioners, these techniques, these treatments, these ideologies that really stand the test of time.
Thank you for joining me for this episode of AgeLess. If this episode resonated, please subscribe, share it with someone you love, or leave a review. And as a thank you for being here, you can redeem an exclusive free skin consultation and 15% discount on the One Dermafacial with my team in my Clinic One Aesthetic Studio. Simply follow the link in the show notes and enter the code AGELESS15 at checkout. So I leave you with this reflection. What does ageless mean to you? Let that question be the start of your rebellion against ageism and false information. I'm Dr. Jonquille Chantrey, and this has been AgeLess.